Action News Investigates has learned death rates at area hospitals are going up.
At some hospitals, mortality rates for some conditions have more than doubled in 5 years. Investigative reporter Paul Van Osdol is live for us in Sewickley tonight. So, Paul, why is this happening?
Well, Andrew, experts cite a variety of reasons, from sicker patients to staffing shortages. Action News Investigates spoke with one woman who says her father died at a local hospital after waiting more than an hour to see a doctor.
It's something I'll never forget, and it's very hard to speak about, but it's not right how he was treated.
In February 2022, Jamie Toth's father, John, went to UPMC McKeesport Hospital complaining of chest pains. According to her lawsuit, he waited an hour and a half before a doctor saw him.
I didn't understand their lack of urgency to somebody that is sitting here clearly distraught.
When John finally saw a doctor, he had a heart attack and died. He was 67. In court papers, UPMC denies any negligence or recklessness and says their records show John was treated earlier than the lawsuit alleges.
This was his time to be retired and enjoy family and enjoy life and to finally relax, and that opportunity was taken from him.
A state report says the Pennsylvania hospital mortality rate for 11 conditions, ranging from heart failure and stroke to sepsis and pneumonia, increased from 2017 to 2022. The most recent year data is available. That does not include COVID cases. A spokesperson for the State Hospital Association tells Action News Investigates any increase in in-hospital mortality is concerning, and we are working to dig deeper and meet with hospital quality leaders to better understand the cause and what can be done to address it.
The mortality data looks like it's inching in the wrong direction.
Dr. Paul Frampus, UPMC's medical director of patient safety, says one reason for that, patients are sicker.
So we're seeing a population that's sicker because they've had things that weren't caught in screening, or they've had indolent little problems that have become bigger problems. So the people that are actually inside the hospital now are sicker than they have been before.
One of the biggest concerns is sepsis, an infection that left untreated can lead to death.
The sepsis problem is really challenging.
State records show the sepsis mortality rate from 2017 to 2022 doubled at Butler Memorial Hospital and Heritage Valley Beaver and tripled at Heritage Valley Sewickley. The chief physician at Independence Health, owner of Butler Memorial, says in a statement that nearly all cases involved patients with severe chronic medical conditions coupled with a sudden affliction. This combination results in a very high severity of illness and an ensuing poor prognosis. A nurse at Heritage Valley Beaver says early detection is critical to treating sepsis.
The clinical signs that lead to sepsis can be missed if you're not focusing on especially the patient's vitals and looking at the patient and seeing how they're acting.
Experts say staff shortages can impact sepsis treatment.
We're elevating and putting less experienced people into positions where previously were filled by very experienced people. It makes it very challenging to intervene early when we're looking at, for sepsis, for example.
Mortality rates for respiratory failure have also increased, up 50% at UPMC Mercy and nearly doubling at UPMC Passavant. Dr. Frampus says he and others at UPMC are working on it, using simulations like these so medical staff can respond to a crisis quickly.
We have been, as a system, looking at all of our protocols, all of our algorithms that do two things. One is prevent people from getting worse once they have a minor respiratory infection to progress to a significant respiratory infection that lands them in the ICU. And then secondly, adjusting our ICU care to make sure it is always aligned with best practices.
A Pittsburgh group that monitors patient safety says the increased hospital mortality rate is not just a local problem.
We need to start looking at our major categories of harm and preventing harm before it occurs.
The Jewish Healthcare Foundation is leading an effort to create a national patient safety board modeled after the NTSB. Instead of failures like the Fern Hollow Bridge collapse or the East Palestine derailment, The Patient Safety Board would investigate chronic problems that lead to patients dying.
It is a moral imperative. Safety isn't optional. It should be the mission of healthcare.
Jamie Toth likes the idea, especially if it can prevent a death like her father's.
A group or a team to hold hospitals accountable for how they react and how they run their operations would definitely benefit not only the hospital but the patients.
Bipartisan bills to create a national patient safety board have been introduced before Congress. We will be tracking them and we'll let you know what develops. Reporting live in Sewickley, Paul Van Osdol, Pittsburgh's Action News 4.